All right, good afternoon, you guys. All right. How is everybody doing today? Good. Okay. I'm going to send out a email this afternoon, but just to reconfirm, exam is on Monday at 11 a.m. Okay. So email that out just to make sure it is written down. All right, so any questions that we have before I put together a little Jeopardy game as a refresher for a couple of questions for the exam. Any questions before we, any clarification or anything like that? Okay. All right, so I think the best way to do this, since we're not in class and we are in on Zoom, is I'll put up the Jeopardy, and then if you can put the answer in the chat box. So have your chat open, and then give me your best answer. I mean, yes, and then we'll go over the answer together. Okay. All right. Let's see if I can get this to come first. Okay. It's my mouse. There it is. And none of my groups came up, unless they're going to come up in a minute. So group 1, group 2, group 3, group 4, and group 5. So I'm looking at you guys in a square pattern here. So Miss Filbert, would you like to go ahead and choose the first square?
I'm not seeing anything on my screen. Did you put it up?
No, nobody's. Okay, then maybe it's because of this. Okay. Sorry, I started to share it and then I didn't. All right, is this better? You can see it now?
Yeah.
Okay.
I'm not sure. Can we, from any group?
From any group, and then, like I said, we'll, where can my, oh, I want my, no, I want my chat box to be open so I can, there we go, so that I can see who, how the answers go.
So when
pick one.
So when I pick one, I have to put the answer in the chat box, or
yes.
It doesn't matter?
Yes, go ahead and put the answer in the chat box. That way, we can see how it goes. Like,
okay, I'm gonna do group 1.
Group 1 for
Q1.
All right, for $100. Here we go. The medial nasal processes are involved directly in the formation of the embryo's blank of the nose during prenatal development. Bridge, sides, bridge, and sides, or nasal placodes.
Okay.
Everybody answer, please, not just you.
Okay.
Yeah, everybody answer, yes. We'll just have somebody pick to the question. That way we can see how everybody does. Nice, good job, you guys. Yes, it was, let's see. This was the bridge. There you go. You guys all did well on that one. All right, Miss April, let's see if it takes it back to the, nope, okay. Well, how do we go back to the, okay. I'm gonna pick one.
Group 200.
Got it. Which of the following is not a usual way for erosion of enamel to occur? Bulimia, gastric reflux, drinking carbonated beverages, or acid production by karyogenic bacteria?
Oh, shit.
All right, has everybody gotten an answer, or a chance to answer? So erosion can be caused by bulimia, it can be caused by gastric reflux, and it can be caused by drinking carbonated beverages. Erosion will not be caused by acid production of karyogenic bacteria. So whoever answered D, great job.
Is it actually the carbonation that does it, or is it just like that carbonated drinks normally have like acid in them?
It's the carbonation with the sugar and all of the because like even carbonated waters are not great for your teeth because of the acidic. The table clinics that we had the other day, I wish they would have checked the acidity of carbonated water, because they did look at the different water types and how even like Dasani, which is a, bottled water, is very acidic compared to other waters. So
I have a question.
Yeah, can I? Oh, sorry.
So is it, I didn't say, I said like bulimia because it's like, it's not like actually bulimia, it's the stomach acid from throwing up from bulimia that would cause that, right?
but
Not actually the illness of bulimia.
but that does. The so being bulimic is the condition that causes you're forcefully making yourself throw up. And so when you are seeing a patient, you will see acid erosion on the back of their teeth. So those are just like gastric reflux would be the same, basically the same thing. All of those conditions can cause erosion on the enamel. Does that make sense?
Can I also point out the book? I have in my notes, I don't know the specific page, but I took it directly from the book. It says that enamel can be lost by enamel caries, a process in which a cavity is created by demineralization due to acid production by karyogenic bacteria.
So that would be the actual not erosion of the enamel. That would be the actual demineralization that is caused by acid production, causing not an erosion of enamel. So it doesn't look the same. This is talking about like, yes, bacteria, you have your different types of bacteria, plus you add in your fermentable carbohydrates, and that's going to cause an acid production, which takes the minerals out of the teeth, which then if those minerals if the enamel is not remineralized, then it causes tooth decay. For this particular question, we're actually talking about the erosion of the enamel, where it is like attrition, erosion, abfractions, those type of things. Okay. All right. Great questions. I love that we were able to have that talk because it's actually talking about the chemical erosion, not the erosion from and
Not demineralization.
not demineralization. Yes. Okay, let me see. I have to go back to the. See, when I played this game before, it wasn't this difficult. Okay, go ahead, Devin. Go ahead, choose a topic, please.
Group 4 for 400.
Go big. All right. The mesial marginal ridge of the permanent mandibular second premolar is blank degrees to the long axis of the tooth. 25, 45, 60, or 90. All right. You guys did good on this one. The answer is 90 degrees to the long axis of the tooth. All right, good job. Let's see, Miss Jeanette.
Group 2 for 200.
Ma'am. Which of the following statements is correct when considering odontogenesis? Has a clear-cut beginning and end point to the process? Does not include maturation of the dental tissue, parallels formation of the face, or does not have any identifiable stages? I don't know why it says 200 question from sutures. All right. Let's go ahead and see. All right, so the answer is C. So odontogenesis is the formation of the teeth, right? And so it parallels the formation of the face, remember? So as our face is forming, our teeth are forming kind of at the same, they start at that same time, okay? All right. All right, Miss Sam.
Let's do group 4 for 300.
Group 4 for 300. All right, from its labial view, which of the following helps one to distinguish the newly erupted permanent right maxillary canine from the left? Is it that the distal outline is longer than the mesial outline? The depression between mesial contact area and the cemento-enamel junction? Mesial and distal contact are two different levels, or the mesial cusp slope is longer than the distal cusp slope? Has everybody put in their answer? Like y'all are done before I finish reading the long question. It is C. Good job, you guys. Mesial and distal contacts are on two different levels because the distal cusp slope, I think, is longer than the mesial cusp slope on the canine. And then the distal outline is shorter up at the top. The mesial outline is a little longer, but the contacts are different. All right. Miss Natalia.
Let's see, group 4 for 200.
Yes, ma'am. Which of the following features is noted on a newly erupted permanent mandibular canine? Cingulum is offset to the mesial, mesial height of contour in the cervical third, mesial cusp slope is shorter than the distal, or a well-demarcated marginal ridges. Mesial height of contour in the cervical third. Let me pull up a picture of the canine real quick. There it is. That's not correct. I took this from there. Cingulum is offset to the mesial. Let's take a look at this tooth. It is almost linear. And then the mesial cusp slope is shorter than the distal. That is true. And a well-demarcated marginal ridge. Well, cusps, they have their marginal ridges on. I would say it's C. So for you guys that put C, that's what I think it is. Good job, you guys. All right. Sorry that that's wrong. Got them from the test bank. No excuses. Okay, let's go. Let's go back up here. Okay, so Miss Mary Beth, go ahead and choose one.
Group 4 for 500.
Yes, ma'am. All right, which of the following can cause patients to have problems performing adequate home care on the permanent mandibular premolars? Narrow lingual surfaces, buccal crown inclination, lingual crown inclination, or wide lingual surfaces? All right. Good job, you guys. Lingual crown inclination. So that means it tilts into the lingual and it makes it hard to get the toothbrush in there. Okay. All right. Miss Bree.
Let's do group 5 for 300.
Yes, ma'am. Which angle classification of malocclusion in the permanent dentition is characterized by an ideal mesial distal relationship of the jaw and the dental arches? Class 1, Class 2 Division 1, Class 2 Division 2, or Class 3? Good job. Good job, you guys. This is usually a harder concept, so I'm really glad that you guys kind of got that one. That was good. Good job. All right. Elena.
Let's do group 3 for 400.
Yes, ma'am. Which of the following tissue types is most likely the source of cementogenic cells in adults who have undergone root planing? Bone marrow, periodontal ligament, residual cementum patches, or alveolar process?
Did you talk to Chief? Chief is not there today, right? He's on leave, right? Yeah, if you don't have anything going on, you can go home. Why not? Just make sure
Will
you
be on
send
the
it
classroom.
Yeah, thank you.
Yes, good job, you guys. B, periodontal ligament. Let me see if I can get that arrow. There we go. Perfect. All right. Let's see. All right. Brittany, go ahead.
Group 2 for 500.
Yes, ma'am. All right. Which of the following is not a prominent histologic characteristic of pocket epithelium? Ulceration, gingival hypoplasia, smooth surface, or wrinkled papillary relief? Smooth interface, excuse me. Not a prominent histologic characteristic of pocket epithelium.
I don't know what to do on it. Maybe have all of it. What?
All right. It is B. I mean C. It is C. Sorry, I was looking at someone's answer. All right. So yes, it is B. C. I'm going to lose my mind here. Ulceration. So I feel like I say this all the time, but I can't remember if I said it in this class. Pocket, when they talk about a periodontal pocket, a pocket is a disease tissue, is a disease sulcus, right? And so if you're going to have a diseased sulcus or a pocket, your epithelium is going to be ulcerated. It could have hyperplasia. It could be have a wrinkled papillary surface, but it's not going to be smooth because it's not healthy. Okay. Does that make sense? All right. Miss Shelby.
Group 2 for 100.
Yes, ma'am. All right. The dental lamina is an embryonic structure that develops from the oral epithelium, the mesenchyme, neural crest cells, or endodermal layer. So the dental lamina. What are you trying to say, Mary Beth? Okay. The test answer sheet says A, oral epithelium. But a lot of you guys put mesenchyme. The dental lamina develops over there. Ectomesenchymal, the lamina dura. The oral epithelium grows deeper, penetrating the ectomesenchyme and introduced to produce the adjoining layer, the dental lamina. So the oral epithelium grows deeper, penetrating the ectomesenchyme and is introduced to produce the dental lamina. So the dental lamina develops from the oral epithelium. Okay. I like to double check because sometimes these aren't right, and I like to double check the answers. All right. So everybody, dental lamina, oral epithelium, right? Okay. All right. Tara.
Group 1 for 300.
Group 1 for 300. Okay. The fusion of the two palatal shelves with the primary palate is dependent on the ingrowth from the maxillary arch, change of position of the nasopharyngeal sinus, continued vertical growth of all processes, or change in the position of the tongue. Okay. The answer here is D, change in the position of the tongue. All right. Miss Courtney.
Let's do group 3, 500.
Group 3, 100, you said?
5.
5, sorry. All right, which of the following divides each dental arch into quadrants? The cervical line, the midline, the line angle, or the point angle? Yes, it is the midline. Okay. All right, Miss Alicia.
Can I do group 1 for 400?
Yes, ma'am. Which of the following statements concerning tongue development is correct? Tongue development begins as a triangular median, swelling, or tubercle impar. The copula is formed from fusion of mesenchyme from mainly second parts of the fourth pharyngeal arches. The foramen cecum is the beginning of the thymus. Tongue development during 8th week of prenatal, or tongue develops during the 8th week of prenatal development. Okay. All right, so the answer here is A. The tongue development begins as triangular median swelling or tubercle impar, or the median tongue bud. Okay, and well, things got moved around, and I think I gave everybody a chance, right? All right, let's go back up to Ms. Filbert. Go ahead. Go for it.
Let's do group 5 for 500.
Yes, ma'am. What happens when a tooth is prematurely lost in the permanent dentition? Neighboring teeth usually tip into open space. Occlusal overall becomes more stable. Excuse me, occlusion overall becomes more stable. Occlusal harmony becomes easier to achieve. Teeth move into alignment without super eruption. All right, good job, you guys. The answer is A, the neighboring teeth move into the space. All right. Miss April, go ahead. Choose again.
The 500 group 1.
Yes, ma'am. Which of the following must be suspected in a primary or mixed dentition if there is severe periodontal inflammation and destruction with evidence of little dental biofilm? Gingival disease, chronic periodontitis, aggressive periodontitis, or necrotizing periodontal tissue. If it's primary or mixed dentition and it's severe periodontal inflammation and destruction, what would it be called? Good job, you guys. All right, yes, the answer is aggressive periodontitis. All right. Devin?
Can I do group 3 for, is it 300 that's open? Is it blue that's still open?
Yep, yes, blue's still open, thanks.
Okay.
300, okay. Which of the following is not associated with dental hypersensitivity? Enamel and cementum do not meet. Dentin exposed due to caries process. Blocking dentinal tubules or branching of the dentinal tubules. All right. Good job, you guys. Oh, did I forget to color it in? Quite possible. It is the blocking of the dentinal tubules. That is associated with not like with treatment of hypersensitivity, the blocking of the dentinal tubules. Oh, there it is. It came finally. Thank you. All right. Look, Mary Beth. Go this way.
The blue ones are the ones we haven't done, right?
Correct.
Can I do group 2 for 400?
Yes, ma'am. When the deeper tissue of the periodontium is affected by periodontal disease, what is the condition now considered to be? Gingival hyperplasia, gingival recession, gingivitis, or periodontitis? You guys are correct. It's periodontitis. Because if it just stays in the gingiva and it doesn't have any bone loss, it's gingivitis. Gingival recession, you could have some bone loss, but it doesn't mean that it's, you know, it is affecting the periodontium, but it's not the deeper tissues of the periodontium. So, all right. And then, like I said, gingival hyperplasia is overgrowth of the gingiva. All right. Okay, Miss Natalia.
Let's see, group 2 for 300.
Yes, ma'am. Where does the dental lamina begin to form first in the developing dental arches? Near the midline, adjacent to the mental foramen, over the region of future molars, or adjacent to the developing TMJ? All right. Am I giving everybody enough time to answer? Yes? Okay. Yes, you guys are right. Near the midline. It starts here and then, remember, it goes. So. All right, Miss Sam.
Group 5 for 400.
How would the maxillary incisors be described within a permanent dentition case of a class 3 using Engel's classification of malocclusion? Flared mesially, complete crossbite, inclined labially, or protrude facially? So the answer is B, complete crossbite, and I think it's marked wrong. Yeah, it's B, because remember, class 3 is when your molars are your mandibular molars are mesial to the maxillary molars, therefore causing the front teeth to mandibular front teeth to overlap the maxillary front teeth, therefore causing being in crossbite. And then Miss Jeanette.
Group 4, 100.
The lingual ridge is located blank on the lingual surface of the permanent maxillary canines, mesiodistally, incisor-cervically, obliquely, or cervically. You guys are correct. It runs from the cusp or the incisal edge or cusp down to the cervical, straight through the back. And then there's your mesial and your distal ridge, and then you have your little fossas in the middle there, okay? All right, down to the 3, Miss Elena. 4, there's 4, sorry.
Okay, let's do group 1 for 500.
During root development, the Herwig's epithelial root sheath, or HERS, is entirely composed of all layers of the enamel organ and dental papilla, inner and outer cells of the dental papilla, or inner and outer enamel epithelium. So remember the Herwig's epithelial root sheath, you have your inner, you have your inner enamel epithelium and your outer enamel epithelium, and then they come together to start to make that the root. So the answer here is D. All right, Miss Brittany. Unmute yourself.
I'm muted.
You're fine.
Group 5, 200.
So group 5 for 200? Yes, ma'am. Child patients within the mixed dentition period and their supervising adults may not notice the presence of the newly erupted permanent blank of either arch, because when it erupts, it appears just like a larger primary second molar that is adjacent to it. It's the canine, second premolar, first molar, or second molar. Good job, you guys. C. You are correct. It's that first molar.
Can I ask a question about the
Yes.
one we did before this? Sorry, it's been on my mind. So
Oh,
when
which one?
the class 3 malocclusion, when something,
Yes.
when, so the answer was that it's in crossbite, right?
Yep.
So when crossbite is when teeth are, like mandibular teeth are
on the
protrude further than the maxillary teeth, right?
Well, yes. So you can have a crossbite in the posterior, where instead of the maxillary teeth overlaying the mandibular teeth come in front. Or you can also have an anterior crossbite, where it's just the, because of the way that the bite moves forward, your maxillary teeth come in front, or your mandibular teeth come in front of your maxillary teeth. Or you can have one single tooth in crossbite, or you can have just one side. So go ahead and ask your question.
So I feel like if mandibular teeth are protruding, like they come out further than the maxillary teeth, isn't that the same thing as them protruding facially?
No, because protruding facially would be that they're at a tilt flared, rather than the whole art. Yeah, like, so whenever we're talking about the class 2 and the central incisors are retracted, or they wouldn't be protrude, but then class 2 type 1 is they're like almost protruded a little bit. They come out a little bit more in front. So the flared, except for I think on that question, I can't remember what question it was now.
Sorry, I should have asked earlier, but it was on my mind.
It's okay. It's okay. We're almost done. And it does, because like it says on each one,
So class 3 isn't an underbite?
yes. So that means, being that it's an underbite, you would be in crossbite in the front.
Okay.
Yeah. Here. Okay. So flared mesially would be that it wouldn't be flared. Inclined labally would be that they leaned forward, right?
I read it wrong, I realized.
Right.
Mandibular incisors.
So yeah, I know that. And Mary Beth was on campus today while we were giving the 21s a test. And one of the things that as instructors, we all notice is that, like, take the time that we give you to read these questions. There are it's one word sometimes, the word not, or the word except, which is very common. And they put those in all these test bank questions because of the fact that that is exactly how they ask you on the national board. You know, these are contraindications, except, and like, it'll literally be, you know, and it's easy because it's easy to mess up because we're, you know, we know so much that you see an answer that you know that is a contraindication, and you see contraindication and you mark it, and before you know it, it is sent off and you're like, oh, it said all of these are contraindications except, so you've got to look for the one that isn't a contraindication. And you know, you'll say it and we'll hear it and we understand, but it really, you know, because people will tell, you know, students will tell me all the time, that's a trick question. We are not trying to trick you. The companies that make the test questions that literally come straight out of the book, they write them, they're going to do a much better job of writing a test question than I will, because of the fact that they are writing test questions like they are preparing you for your board exam.
Can you review your answers on the boards? Like, you can't go back. It's like once you answer it, you go.
Oh, yeah. You can, like, I mean, it's like a 300 question test, 400 question test, but, and there's like, you know, I would recommend looking at each section that you do and like reviewing it. You know, that's one of the things that, like, the reason when I give you paper tests, I allow you to write on the test is it is helpful to process of elimination and cut out, like, you know, like the other day on that test, how there were 2 answers that were exactly the same. Well, clearly, if that happens, one of them they can't both be the answer. So you're 50-50 at that point, you know? So those 2 are out and you've only got to deal with the other 2 answers. So you will be more than prepared for that exam when you get there. You take a whole 6-week course on reviewing for it. But I'm just like, at least Miss eBay and I, who, you know, we teach very similar. We don't really give you a time limit on the test because, you know, we want to give you that opportunity to read through each question as you need to. And I don't like feeling rushed. So, I mean, but, and they give you adequate time for the board exam as well. So, sorry, totally got off there on a soapbox with that, but I do that. All right, let's go back to but did that help answer your question, Alicia? Okay.
I realized I read it as mandibular teeth, not maxillary teeth. I was just excited and I read the question.
See, I do it too. And sometimes I look at the question and then I'm like, wait, that's not what it, because I go to read and then I have to I hate taking tests, guys. It's one of my, this is why I do much better in a master's degree program where I have to write papers instead of take tests. So I just write all the time. Okay, so that was that, Brittany, you did the last one, right? Okay, Shelby?
Group 1 for 200.
Group 1 for 200. All right. From what is the nasal cavity derived from during prenatal development? Medial nasal process, octic placodes, lateral nasal process, or nasal pits? All right. Yes, the answer is D, nasal pits. All right. We'll go up here and click the 100. All right. The clinical attachment level is the measurement of the position of the gingiva in relation to the cemento-enamel junction, the thickness of gingiva in relation to the root, the length of the crown in relation to the root, or the position of the CEJ in relationship to the alveolar crest? Okay, so let's talk about this one. The clinical attachment level is the amount of clinical attachment that we as clinicians measure. So we will measure this with a periodontal probe, and it is the position of the gingiva in relation to the cemento enamel junction. So when you perioprobe, you're going to the base of the sulcus, which is where the junctional epithelium or the epithelial attachment is, and you'll go in and you'll measure that. If the tissue is enlarged, it's going to be a positive number in relation to it has 3 millimeters of overgrowth, right? So if it's a healthy 2 millimeter pocket and you have 3 millimeters of overgrowth, then it would be a 5 millimeter clinical attachment level, okay? If you have recession, you're going to take away. So not only do you have you might have a 2 millimeter probing depth, but then you have 3 millimeters of recession, therefore giving you a 5 clinical attachment level, but it's a negative, like it's a positive 5. So it's 3. It's the pocket depth plus the probing depth. I mean the recession. Probing depth plus the recession gives you 5 millimeters of attachment loss. And then you'll get to know this more, but it is the position of the gingiva in relation to the CEJ. Because if the gingiva is apical, you're going to be removing or adding the recession from the CEJ to the gingival margin, right? And vice versa. If it's enlarged, you're measuring. You'll hear this term, clinical attachment level, in this class, in my class starting in October, and then you'll hear it again in perio. So it's just a term that you'll have to get to know, okay? Any questions about it? Just know right now that it is where it's the relationship between the gingiva, the position of the gingiva, and the CEJ. All right, you ready for the big final Jeopardy? Which tooth is this? All right, everybody get a chance to answer? All right, so I'm gonna go through a few steps with you when I do this. Okay, so first thing I do is I look at the roots, right? And we can see from this right here, it's a 3-root tooth. So we automatically know it's a maxillary tooth, okay? And then I'm not gonna be testing you on primary teeth. You're only gonna be, so you automatically know it's a permanent tooth, okay? You have if you're going to work in pedo, you're going to get to know those baby teeth really well. know that they're A through K, and you'll be able to tell a permanent from a primary. But I look at the root, I can see that it's a third, a maxillary tooth, right? So we have our permanent maxillary. Now, which way are the roots? Okay, this here is the buccal surface. How do I know that? Two things. One, I can see the way the groove is on this, and how it has a little bulbous area here. You see it from the distal here, and you can see it from the mesial here, this little spot here. So I can tell this is the buccal, and this is the lingual. The roots are flaring towards the distal, so it automatically tells me that that is a right tooth, okay? I can tell that this is a right maxillary molar, okay? Now, I look over here at the lingual, and it's got the cuspa carabelli. So therefore, it's a permanent maxillary right first molar, because the cuspa the first molars have that extra cusp, whether it be the cuspa carabelli on the maxillary or the distal cusp on the mandibular. Now the second molars are going to be very, very similar, but they're not going to have that extra cusp. Okay, so that's how you distinguish the first from the second. And then it's not a third molar because it's not smaller. It doesn't have, they're not, the fusion in the roots is a little more apical than the first and second molar. Yeah, was that helpful? When you take it down. All right, so I am, let's go ahead and take a 5-minute break. And then go ahead. Oh, go ahead.
Are those always like in the same order? Like when you show a tooth image, is it always lingual, buccal, distal, mesial? Okay.
No.
So, okay.
Because, and let me stop sharing real quick. Okay. And the reason for that is, it's, ideally, what I would really like to do, and maybe I'll do it and I'll just do it as a combination, but I'll have the picture, maybe for your final, I'll have the pictures up on the wall, like on the screen, maybe on my tablet. That way everybody can kind of get a visual of it. And then I might give you the exact tooth to where you can take a look at it, like an actual tooth. So it would be, so like, if I give you image number, if I give you that image, I'm going to also give you tooth number 3 in your hand. Does that make sense? So that you would be able to see it, it's the same tooth, and it would be able to look at it in a different way. Like, hey, all right, there's a picture of it on the wall, but let me go ahead and let me take a look at it in the cup and see if I can figure out if that is correct or not, right? But that goes for the same thing, like, because you never, so one student has a canine and a premolar that are swapped. Okay, so where it is 9, 10, 12, 11, 13. Okay, and I almost had her make me, or I almost asked her if I could take a picture of it to show you guys. Like, like, that's how you will be, because you never know. You're looking in her mouth and you were just going along, and then all of a sudden you're like, wait, those 2 teeth are out of place. And so that's part of this tooth identification, is it might not, I have a patient here that his tooth is completely turned around, completely rotated. So his lingual cusp is mesial, and his lingual cusp is buccal, his buccal cusp is lingual. So it's off. So we have to, we have to be able to see those teeth in all different, to determine. You have to be able, like especially with that tooth I just had up there, you have to know that that buccal groove is on that molar is a little deeper and has that. You have to know the buccal appearance as well as the lingual appearance to be able to determine, that extra cusp. I'm sorry?
With the lingual of first molar, like usually the fused roots are on the lingual. Asking, not telling.
Wait, no. You said the two roots are on the buccal.
You're saying like the two separate roots, like the
Yes. Are you talking about the first molar? Or the
first-
molars?
the
Yeah.
first-
Remember that lingual root is the longer, thicker, and so it's like kind of grabbing, whereas the the buccal roots are always there's two, a buccal lingual and a buccal, a buccal distal and a buccal, a mesiobuccal. I'm losing my train of thought here. Mesiobuccal, distal buccal root, and then you have your lingual root. So the two are always going to be on the buccal surface. That's another way to determine that.
I have a question.
Sure.
It's based on the determination of which tooth is which. So when I saw those pictures, I obviously saw the roots, but because there is no like labeling, this is lingual, this is mesio, this is that, it's hard to tell. So are there specific ways, like you were explaining, I know you're explaining from your like years of experience, you can actually tell that this is this. And then do you have such kind of, how do I put it? Like things we should look out for when we see certain things, like when you were explaining those little marks from the buccal side that goes this way, you'll be able to tell. Are there,
Well, and then
how
if
do we
you're, let's take a break. And I have 3 different sets of PowerPoints. They have like 5 or 6 pictures each that we can go through and talk about as a group. Does that sound good? Yeah. Okay. Take a 5-minute break. Let's, and then we'll come back and talk about, and we'll do that. We'll do just that. Okay. All right. Let's go ahead and, okay, you guys can hear me, right? Let's go ahead and start with this tooth. Can everybody see through this screen? Okay. Anybody want to take a shot in the dark and tell me what tooth that is?
Number 6.
It is number 6. Good job. So first thing I look at with the anterior teeth is the root. You can see here that there's a slight flare in the root towards the distal. You're not going to have so much of a distal tilt like this on your centrals and laterals, but definitely starting with the canines, you get a little bit more of that. The other reason I know is, so this is the facial surface, right? Or the buccal, facial because it's anterior. This is the palatal surface. So you can see the cingulum here. You can see your lingual ridge. You have your mesial and your distal marginal ridge, right? So distal is over here, mesial is over here. And then you can go and look at this part, but I usually tend to look at it from buccal and lingual for especially the canine. Remember that your canine, the mesial slope here is going to be longer than here, okay? Your height of contour is going to be slightly off. And then your mesial slope is going to be, it's almost centered, but you have your little bit shorter here and a little bit longer here on the slope. So this would be your right canine. Now, obviously, if it was your left canine, it would be a mirror image. Everything would just kind of be flipped. Any questions here about the canine? Was that helpful at all, Philbert, for looking at like this canine tooth? I can't hear you. You're muted. I'm sorry.
Yeah, sorry about that. I didn't see that. When you talked about the root part where it's facing, yeah, that makes sense.
Yeah. For some reason, and I don't know why, but even with the molar that we were looking at earlier, it does that little flare to the distal. So that is a big indication that that is, think about the way the distal is, you know. And I mean, obviously you can look at the buccal and the lingual of these teeth and you can kind of see this is smoother, doesn't have the fossas like the lingual surface does, right? And it doesn't have the cingulum.
Yeah, so for the other one that we saw, the first, the maxillary first molar, the right maxillary first molar. So if that's not the one with the extra cups, that's a distinct feature we have on that one. If it doesn't have that one, now what are other things we should look out for? Because sometimes
if it doesn't have that, if you're looking at the molars, if it doesn't have that fifth cusp, it's going to be a second molar.
Yeah, because
right?
the third one is usually fused.
Third one usually has a much more fused root, especially because I get all these images. I took all of these images from BoneBox. And the, I'm like exhausted. Sorry, my train of thought is off. The cusp, the flare, we're going to talk more about the molars in a minute. So maybe my statement will come back. So this is your right canine. And then let's see if we can, yeah, I'm going to get to the posterior. Anybody want to guess what tooth this is?
It looks like a central incisor.
Is it 8?
Okay,
7.
it is 7, and I'm going to show you why. This is number 8.
The root's little.
Okay. All right, let me show you the difference between 8 and 7, right? 8 has a little bit more of a straight root, right? You see this here? A little bit more of a straight root. Whereas watch 7. 7's got that little curve to the distal again, see? So this is going to be a right lateral incisor, right central incisor. This is sharper than this side, so this automatically makes it the mesial.
Can I see the incisal of 7 again?
Yes.
Is it always like that? I mean, the number 7, the roots always facing that way, because sometimes they look so much alike.
They do look a lot alike. For the purpose of this test, I would pay attention to those roots. And if you have the Bone Box app, look at them. You look at them and flip it around and look at the way that those roots, because even, let's see, where is that section? Right here. On that box where it talks about, yeah, maxillary center incisor, maxillary. So looking at the root, specific root features. Yes, it's a single root, but when you're looking at the maxillary lateral incisors on that box, it specifically says root curves distally with a sharp apex. Look at that sharp apex. And then it says no proximal root concavities this is for the central incisor maxillary, and that it's a rounded apex. Now watch. I don't find this to be very rounded as much as it should be, but rounded as opposed to sharp with a distal tilt. Is that helpful? Because if you're, okay,
Yeah.
so one of the things that I would suggest is looking in this book at the charts, because of the chart, and you have the Bone Box app, right? It really is beneficial. So touch number 8 and touch number 9 and read through the specific crown features and twist it around. Take a look at because so this is number 7. Let's take a look at it. It says, yes, general crown features are exactly the same on all of them, a maxillary and mandibular. Okay, they have an incisal ridge, they have an incisal edge, they have angles, they have a cingulum, so those things are all going to be the same. You have to look at the specifics. So the central is wider mesial distally, right? So it's just a bigger tooth. And then, yes, the lateral incisor shows greatest variation, but it looks like a smaller central. And I understand that seeing them not compared to one another could make it difficult to, and yes, I have 15 years experience with looking at these things. I hope to God that I know what they look like, right? But think about the little features. The main difference when you're looking at these two teeth is you're looking at the root, right? Because everything else, it's a smaller version. The other thing I think it says is this one, the lateral has a more centered cingulum. And it says pronounced offset cingulum for the central incisor. So you see how it's slightly offset this way, where this one is a little more centered. I think it's offset too, but so the questions and come from like these boxes, and so I think it will help looking at this and looking at the teeth individually when you're studying.
I have another question.
Sure.
I am having trouble like differentiating between the buccal and the facial on premolars.
Okay, let's see.
I'm
I think
looking at the Bone Box app right now, and
okay, so these are all centrals. Hold on, let me we can go to premolars. Move on to premolars.
Also, like differentiating between a second and a first premolar.
Okay, we can go over that. That's sure. Let's see. This is the review. Let's see. So there's one. one. Hold on. I gotta find you guys. I lost you. There you go. I don't think I have them all on. Let's see. Yes. This one, I think, yeah, I think I only have the. Right. We'll start with this one. Okay. All right, so you first and second on maxillary and mandibular? Or just the mandibular, Bree?
Sure, it could be both.
Okay, so one of the key features for the maxillary, between the maxillary first and the maxillary second premolar is, for the Bone Box app, it does, and for our book, it talks about the furcation. If it's a furcation, it's an automatic first premolar. Okay. You can also from, and I might have to go get my iPad and plug it in. I can maybe do my phone. For the premolar, the first premolar, that buccal cusp is going to be a lot more, is going to be almost equal, but more prominent. And then remember that it has, the first molar has both a mesial groove and a distal groove. So again, these are things that I'll try to, I'm trying to, let's see if I can get my iPad to, nope.
I think I got the maxillary, but the mandibular, those kind of look
Okay.
the same to me.
All right, I'm trying to pull up my, see if my, for some reason my phone is not wanting to pull up my, on the Zoom. So I can, yes, I trust this computer. Please just let me get on here. All right, so let's go first. So if you look at it from the lingual, all right, so determining the right and the left, again, you're going to have a little bit of that flaring root, okay? And so this is your first premolar. And looking from the back, you're going to have, or from the it's going to have that mesial ridge, I mean distal groove, sorry. And then it has that mesial lingual type groove on the back of it. And then cusp wise, it really only has the one cusp, right? Is my arrow showing? Can you see my, okay, my mouse moved. It only has the one cusp. Now, when we go to, come over here and look at this one. This one has a little bit of a straighter, the second bicuspid has a little bit of a straighter root. And then this one is the one that can have a Y shape, an H shape, or a U shape, right? And so this one, for the purpose of the bone box and for, and for this quiz, it's going to have the two cusps on the lingual. And then when you look in the book, it says, and you can see those two cusps if I kind of, because remember, sometimes it doesn't, but sometimes it does. On this app, it does. And when you're looking in the book at those differences, like that's where you really want to spend, is looking how to compare the four of them or the two of them in each arch, because yes, I'm going to have it standing up in the correct way. So if it's a picture of, a lower, I'm gonna have it straight up and down. So you almost know automatically that that's a mandibular tooth, right? And then you have to kind of figure it out from there, looking at the different, it's for the first premolar on the mandibular, right? It's a little bit smaller than the second. The second is a little bit bigger. So let's see if we can, look if I can compare on this one. I know I could compare on the other one, but see, it's a little bit smaller crown wise than this one was. That one looks a little bit bigger. And it's like they say, like, but it's not like, this one's so big, it's as big, it's slightly different, but really focus on the specific features of each crown. If you can figure out the root from that point, it will be, premolars on the mandibular are a little more straight than on the maxillary. Any other, did that help you, Bree?
Yes. So
Okay.
second has two cusps on the lingual.
Mm-hmm. The second mandibular has two cusps on the lingual. Yeah. And that, remember, that's the one that has the most variation. It can have the Y shape, which has the two cusps on the lingual, or it can have the H shape. But if I'm using pictures from the Bone Box app, it's going to have two. Okay.
You said there is a spot where you can like compare two teeth?
I believe on the app, on the iPad app, not on the phone app.
I'm on the iPad one. What did you?
I don't remember. And it might just be you have to toggle them back, but I did think that there was the iPad one has a lot more features. That's why you might be able to see them just the bottom arch next to one another. I think my iPad's over here. Hold on one moment. If you put it in dental orientation, you can kind of see the teeth like next to one another. Maybe not the mesials, but you would be able to see the comparison of them. And even the occlusal surfaces, if you can just do, yeah,
No worries, I'll figure it out.
Here, I'm getting the, I'm trying to pull it up right now. All right, there it is. Okay. Oh, there you guys are. Okay, good. All right, let's see. So if you come over to, you guys up here, scroll down to where it says dental orientation and then just the mandibular teeth down here. What's going on with my computer over here? All right, there you go. And then you can like look at the occlusal surfaces next to one another. Like, I mean, even like looking here, right? So second molar, first molar looks like giant compared, right? And so then you have your, what's happening? And then here's your first, your second premolar and your first premolar. You'll be able to see the difference. And obviously this is a Y-shaped, not an H-shaped. But you can see the extra cusp here on the distal. Do you see this? Is this helpful? Okay. And then you can hit maxillary and do the same thing. Like there's all your fossas. All right. Let's go ahead and look at the molars since we're on here, right? Maxillary or molars. Let's just molars. Oh, you can do that too, where you just look at the premolars. Okay, let's go ahead and look at the molars. We'll start with the first, and you can see there's a good occlusion, right? You can see that this one right here has the 3, and it kind of flares. And you can also see in the comparison here that the root trunk of the second is a little bit longer. You can see that here, this root trunk over the first. That first molar is just solidly bigger. I mean, it's a bigger tooth. Oh my gosh. And then same if you were just to look at the mandibular teeth down here. You could see, like I said, the occlusal surfaces, they all kind of flare, you know, to that distal. So that would mean that these are right and these are your left. Any specifics about molars? Anybody want to ask me anything specific? I really think going back and looking at the specifics of the crowns and then specifics on the roots in the book will really help while looking at pictures to help blend the two together. You can see that this, you know, looking at the buckle of these two teeth. No, that's not what I wanted to do. What? It's because I keep touching. Okay. The prominent groove, like I was talking about, and on the mandible, that groove is a lot more prominent on the first molar than it is on the second. See that buccal groove? This spot right here on patients is very common to get a developmental pit and have a cavity there. Because you have those three little pits that come together. Anything more you'd like to ask Ms. Filbert about the molars?
Over time, I think I'm gonna get it, but for right now, I'm fine.
Okay. Anybody else? I know that you were asking about molars, so I'm trying to answer specific if anybody has anything specific. 3 is maxillary, 2 is mandibular. First molar is going to have that extra cusp. And that extra cusp is always, 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 always on the mesiolingual cusp. See? So this is number 3. And it's always going to be on that mesiolingual cusp right here. All right, so if I turn around and I come over here and grab number 14, it's going to be on that mesiolingual cusp. Still right there. It's always on that mesial cusp. And just like on the mandibular, it's always a distal cusp, right? So here's the buccal surface. It's got that extra cusp right here on the distal. So it's going to be a distal, or it's going to be a 19 or 30. Color this. Anything else? I'm here.
And it looks like this is having 5 cups or something.
Yeah, this has 5 cusps.
Is this left or right?
This would be.
That's number 3. Number 14.
Look at the roots. How many teeth? Which tooth is that? Which arch is that in?
Oh, this is mandible.
Good job. And then, so if it's a mandibular, because it's got 2, and it's got, we said it has 5 cusps, so it's automatically a first molar, right? So now
that's what I need to know.
Right. Well, if it's got 5 cusps, so it's got all molars have a mesial buccal, a distal buccal, a mesiolingual, and a distal lingual. The first molars, maxillary, have the cuspa carabelli, mandibular have that distal cusp. So because this is a distal cusp, this is the distal cusp right here. And this is the distal surface. If I stand this back up, and this is mesial, and this is distal, and we've got our roots flaring to the distal, which tooth would this be? Everything's going to the distal. Everything is in the distal. Which tooth would this be?
Is that 14?
14's on the upper arch.
Oh, sorry. 14, 15, 16.
You're almost there.
20, 27. That's left.
Good, good. You're almost there. I feel like I see the little ding, 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 ding. It's coming together.
Is it 30?
30 would be on the right.
Oh. Okay. 19. Oh, I need help.
No. This is so do you see how I drew this on here? So here's our quadrants, right? Our mesial is going to be closest to the midline, right? And our distal is going to be furthest away. So if we're looking at that tooth and the distal cusp is on this side, right? The distal cusp is on, sorry, don't talk, I talk with my hands, I'm really sorry. That's probably more confusing than anything. So we have our mesial, distal, mesial, distal, mesial, distal, in every quadrant, right? If we draw it like this. And we know that is that gonna go away, darn it. And we know that this cusp is on the distal. So if we write this mesial distal, this mesial is gonna be closest to the midline, right? And it's a mandibular tooth, so it has to be here in the left quadrant, the lower left quadrant. We know it's a first molar. So first molars are 3, 14, 19, 30. So this would be 19. Do we want to try some more? I know that we don't have to, but I am here for you if you need that. I'm gonna stop sharing this and we'll try some with the, and I can draw on there too, so. Okay, so this is a premolar, but let's talk about this one. Okay. All right, so let's start by looking at the root, right? These neighbors' dogs, they just stick them out here and they bark all afternoon. So annoying. Y'all don't even know I have a dog because she's good. She doesn't bark. Okay, so it's got 3 roots. So therefore it is a
Maxillary.
Woo, maxillary. All right, Scott. So we know it's a maxillary tooth, so we can push that aside. All right. So, which surface do you think this would be? Let's start with that one. Here's our lingual root. Here's our buccal root. We can't tell quite what buccal root it is yet, but because it's lingual here.
Distal.
I'm sorry.
Is that the distal?
Yes, good job. Let me see if I can right here. That's distal. Here's our lingual root here. Here's our cusp here. So this would be our distal buccal cusp, right? Okay. So this one has to be the
Mesial.
Mesial. Okay. This surface would be our
Lingual.
Good. And then this one?
Buccal.
Perfect. Okay. So now if we look at the occlusal surface, how many cusps does it have?
4.
So that rules out what?
First molar.
First molar. And we know that the roots aren't fused, so that rules out what?
Third molars.
Good job. Good job. I like the way this is sounding. All right. So remember, so now we're looking at our second molar, right? So it is a maxillary, a permanent maxillary second molar. But now we need to determine whether it's a right side or a left side. So let's go look at this buccal. Okay. What do you think it is?
Number 15.
Number 15. Very good job, Miss Bree. Did everybody see that? Did everybody guess 15? Or is everybody just like, oh, Mrs. Calhoun, my brain is bleeding?
Yeah, honestly, I agree with her that it's number 15, but that's because I'm seeing this root here, going towards the distal part. But other than that, I don't know if there's any other feature I need to see that will tell me that this is 15, other than the roots.
Other than the roots. You should also be looking at the cusps because there's only 4 cusps. Because remember, first molar has the 5. It has that extra one. So we can very quickly know that it's a maxillary tooth and a second molar just by looking at the occlusal surface and at the roots. Determining which side it's on is where it can kind of get tricky.
Yeah, so now to tell if this is number 15 or this was number 2, it's going to be hard because for
Look at the
me,
way-
I don't know how the
Look at the way these roots are going. Even from the lingual side, look at these roots over here. This one doesn't really go this, sorry, that was a little crooked. But do you see how they give that slight little flare? You can also tell, because if you remember, this is going to be the distal, because this is a distal, the distal lingual cusp is smaller than the mesiolingual cusp. If you'll read that in your book. So that little cusp right there, so I believe all of the occlusal surfaces are in the right direction. So when you are looking at this, this is the mesial, I don't want to say that's it is correct in the direction that that tooth is. So because this is number 15, that mesial surface is going to be here. Whereas if it was number 2, the mesial surface would be over here and the distal surface would be over here. Right? All right, let's go to the next one. All right. Okay. So let's go ahead and start it off. Look at the roots, maxillary or mandibular tooth. Permanence given. Don't say I didn't give you nothing. Permanence given. Permanent, is it maxillary or mandibular?
Mandibular.
Mandibular, good. Permanent, mandibular. And then let's go ahead and look at the crown. So how many cusps does this crown have?
I think I see 5.
So if it's 5, what crown is it?
It's a first molar.
First molar. Okay, so we got that. We have permanent, please excuse my mandibular, and then we have first molar. Okay, now let's find out if it's right or left. All right, so if the occlusal surface is set up right, where's that fifth cusp?
On the distal.
So is this it?
No,
Is this one?
no.
I feel like I'm playing with my kids here. This one? I am fun. Thank you for laughing at me. And then there's this one. How about this one? Is this one it? Okay. My other class says whenever I give the answer, whenever I'm reading out like a test question, my octave changes for the right answer. So I don't mean to. It's just like I'm like I like for everyone to pass my test because it makes me feel like I got the point across. And then if you don't, but I also know that I give a little and then you have to do a little. It's not all on me. So anyways, here's your distal, right? So that makes this the distal and this the mesial. Miss Filbert, which tooth is this, right or left?
This is the distal, this is the mesial. Let me think.
Does everybody have it in their head? Have a good guess?
Is it number 30?
Yes, it is. So it is a right. So yes, this would be a right. So again, if I do it this way, you have your mesial here, you have your distal here. So if you think of it that way in that quadrant setup and you put it upright, you're gonna notice that it belongs in this quadrant. So it would be a right quadrant. Okay, all right, let's see what else we got. Ooh. All right, so this one's kind of a giveaway, right? All right, so does anybody want to just shoot from the hip and tell me what it is? We know it's permanent. Is it maxillary or mandibular?
Mandibular.
Mandibular. Do you know what kind of tooth it is?
Is it third molar?
It is a third molar, okay? And looking at the, so this will be our buccal, and this will be our lingual. This will be our buccal. This will be our lingual. This will be our mesial. This will be our distal. The reason is because you can see the flare of the root. So which tooth will it be?
Is this 32?
It is 32. Very good. Did everybody see that? Because if I put it this way, you can, I mean, and still, like we can, let's go with this one. So if, so you can't go straight off of here and try to do your mesial distal. You have to look at the way the crowns are set up, right? So let's go. This is a maxillary or mandibular?
Mandibular.
Mandibular, okay. And it here is a very prominent groove. This is a not so prominent groove. Do you want to take a guess on which one's mesial, which one's distal? I mean, buccal, which one's lingual? What is this one?
Buccal is the bottom. That one's buccal.
This is buccal and this one's lingual. The buccal grooves are always going to be more prominent. Not to mention, because they have like a little dip here and they have this little, and you can see it here, this little curvature. So you're not going to have that on this smooth surface of the lingual, right? Whereas this groove here is going to cause this little bit of a hump. And then when you look at it from the side, it gives us a little hump. So we have our buccal here. Oh, which way are these roots flaring? Towards the distal, right? So because we know these roots are flaring towards the distal and this is the buccal, this will be the distal. This will be the mesial. This will be the, all right, who wants to tell me what tooth this is?
31.
Correct. When you're writing it in DAQT, it will be the permanent mandibular right second molar. Okay. Dentition is given, it's permanent. You need to determine whether it's maxillary or mandibular, right or left quadrant. Because remember, if we do it like this, mesial, distal, distal, but this tooth, stand it upright, it's going to be on the right side. This one's made just for you, Brie. It's a premolar. All right, so what surface is this?
Lingual.
Lingual. Good job. And this down here?
Buccal.
Buccal.
Buccal. Okay. So this one is I did do, this would be your buccal surface, so it's not a direct science. And then, so this would be your lingual because it has the two cusps, right? And then your, now I have to think. Mesial, distal. Because if you look at this, hold on, and you've got your flare this way, then you've got your distal. I mean, slight flare. I understand it's not perfect. Right. No. Oh my gosh. Wait a minute. Now I'm getting confused. These are more, and then you have your more, this is your more distal. This is your more mesial. So this might be wrong.
I think it's reversed. Yeah.
Yeah. Okay. So, because I'll have it. Put a big X here, Melissa. Let's not put this one on the test. Or I have to flip this one around, which I can do. So if we do this and we put we have to turn this around, right? You have to turn it around and or you stand it upright like this, right? You have your mesial and your distal. Which tooth is this going to be?
Is this 29?
So because this is think about this. It's going to be on what side? Because here, this is like the direct picture of it.
Is it number 20?
Number 20. Yes. Number 20.
This is a left tooth?
Yes. This is flipped.
Oh.
It's turned all the way around. Yeah.
Yes.
I said, I thought. I made these for the last group, so it wasn't 100%. So if something like this was to go on there, I would flip it around and make sure that the occlusal surface was in the
Wait,
correct
can you
direction.
take off your red lines for a
Can I?
second?
Yes.
Erase the red stuff.
Oh
I think
gosh.
the root kind of looks like the other side.
Yeah.
Okay, yeah, it's fine. They look similar for a second.
Yeah. So that's how I ended up. Sometimes taking pictures of these the right direction was very difficult. Yeah, because the root flares more towards the mesial on this one in this particular image, rather than. All right. Let's see if there's any more. Nope, no more. Discard. All right. Any? Do we want to continue to go over these, or are you feeling a little more confident, or? And I'll send you the recording so you can hear me cheer all weekend long. But it might be good to, there's probably going to be 3 of them, 3 or 4, just like on the last test. And then I have not made the test yet. I contemplated just doing 150 questions instead of 200, just because that just seems like a lot of questions. It will be somewhere in between there. It's if I feel like I've gotten the amount, that I feel like I've tested you on the stuff that you should know. I'm trying to think. Anything else that you guys really want to pick my brain about? If not, I will let you go to study for your finals. I'm sure I'm not your only one. You have an ethics one too, right? Is that a written one?
It's probably a mixture of both.
Okay. All right, I'm going to go ahead and